By donating your platelets, you could give a very special gift of life. Most patients undergo a bone marrow transplant, surgery, chemotherapy, radiation treatment, or organ transplants and need platelets to survive. You can help out by becoming a platelet donor right here at the Guam Memorial Hospital. Here to tell us more about it is spokesperson Connor Murphy and Assistant Administrator for Laboratory Services, Glenda Pangilinan. Thank you so much for coming on. Great to have you here.
Thank you.
First, Connor, maybe you could tell us why people should become donors when it comes to platelets.
Well, just to give a little background, in all of our bodies we have our blood, and it's made of four main components. You have your red and white blood cells, plasma, and your platelets. The platelets are the part of your blood that help it clot and help it stop bleeding. So similar to how we have whole blood donation, there's a process called platelet pheresis, so basically platelet donation. And what happens is that your blood is taken from your body and it's kind of run through a machine that takes out some of the platelets and returns the rest of your blood to your body. And then the platelets can then be used to give, like you said, the gift of life to, for example, a premature baby or someone going through chemotherapy who wouldn't be able to create enough platelets for themselves on their own. So, you know, it's a crucial, really a life-saving procedure that we do right here at GMH. And we want to encourage more people to volunteer to become platelet donors. We're trying to build a good pool of donors who can be called on to donate platelets if the need arises.
And Glenda, you work in the lab. How does the process work? And is it maybe a long process? How can people maybe come in and determine whether or not they could become a donor?
Okay, if anyone's ever donated whole blood before at a blood bank at GMH or elsewhere, the process is very similar. You go in, you go through a screening, which involves a medical history, a little mini physical. We check your blood pressure, your pulse, your temperature, your blood count. The difference with the platelet donor is, in addition to your hemoglobin count, we want to know what your platelet count is. At GMH, in terms of being a platelet donor, because the platelet procedure is a lengthy procedure, unlike whole blood where the draw itself lasts on average 8 minutes, a platelet donation lasts about 1 hour. So because of the length of time and the time commitment on the part of the blood bank as well as the donor, we want to ensure that someone that does go through the procedure, we can walk away with a platelet product afterwards. So anyone who does donate platelets, we do pre-screen them in terms of drawing small vials of blood beforehand to send out for testing for hepatitis B, hepatitis C, HIV. Once that returns in terms of the results and everything's fine and the questionnaire, they pass that, what we'll do is we'll contact the donor and see what we can do to schedule a donation on their next available date.
Do a lot of people on Guam, are there a lot of donors as far as platelet donors are concerned? Do you have a big pool of people who do it on a regular basis?
Just to give you an idea as to the need and the need compared to the number of donors we have, in 2010, there were about 260 platelet requests. So these are requests from doctors for a patient who potentially needed a platelet transfusion. So compared to the 260 requests for platelets, we had only 120 platelet procedures done. So the requests, for some of these requests, although the doctors request for it, not always do they actually end up taking it. A good number do. So in 2010, we performed 120 platelet donations.
Wow.
The 120 platelet donations came from 30 individual donors.
So you definitely need a lot more people.
So yes, we had in 2010, 30 individuals donating platelets at one point or another. Because there were only 30, you know, many of them came back in multiple times.
Wow.
Out of the 30, the good news is 13 of them were first-time donors, which is the most we've ever seen at the blood bank. Previous years, in the course of 1 year, we'd only have 2 or 3 new donors. So that was really good. I was just telling Connor, for January, we've already had 4 first-time donors.
Wow.
So that's great.
Hopefully
we had a push in December.
Yeah.
We had a push in December. Folks came in, they were screened. We got the results back. We gave them a call. They've already scheduled. They came through. So now what we would like to do is to get them to continue to come in throughout the year.
And Connor, you have to I guess, set up an appointment. You have to come in. You can't just show up anytime, right? You have to make an appointment.
Yeah, you would just have to give our blood bank a call and schedule an appointment for your donation, for your screening, and then for your donation. One unique trait of platelets is that they have a very short shelf life. So if platelets are drawn from a person, they only last about 5 days before they expire and we can't use them anymore. So that's why we really want to build a pool of donors so that way we can call them if the need arises. It's not something we can draw a bunch of and then stock up on.
The number to call?
The number to call is 647-2276.
2376.
2376 is for our blood bank, yes.